Getting connected here. All right, I believe we are live. I'm just going to double check and make sure I can see us on the page, and then we'll be good to go. Alrighty, give people a minute to join. Okay, we are live and we are going. Hello, everyone, and welcome to day 3 of Boys Town Newborn Week. My name is Gabby. I've been your host for the week. We've gone live every day talking about a different topic as it pertains to you and welcoming your newborn into your family. Today, we are live with Dr. Danielle Empson, and we are talking all about health and hygiene in the first 6 months. Dr. Empson, how are you doing today?
I'm doing great. Thanks for asking. How are you, Gabby?
Good. Great to have you on. As we
Thank
go
you.
through our live discussion, we are doing a giveaway. So if you would like to win a baby bathing basket from Boys Town Pediatrics, make sure you like this video and leave a comment. So you can comment anything, say hello, let us know what you've enjoyed so far this newborn week. If it's your first baby, your due date, whatever you want to say, we are open to all comments. And of course, if you would like to participate, but maybe don't want to leave a public comment because you're new in your pregnancy or just don't want to leave anything publicly, totally fine. We are watching the inbox, so you can message us directly and that will count as an entry. Okay, so when thinking about health and hygiene related to newborns, Dr. Empson, what are, to start, some general principles for keeping young infants healthy?
So, I think one of the big things is finding a pediatrician that you like so that you can develop a rapport and ask all the questions that you want to ask. I think that's one of the first steps. And then after that, we always talk about like steps moving forward in each stage and age of life for little kids. So, vaccination, super important, doing that right from the get go. And then keeping the baby healthy by keeping the people who are around your baby healthy. If there are people who are going to be sick, or like visitors want to come, but it might be the middle of cold and flu season, or someone's sick and wants to come visit, you just say no thanks. So yeah, I think trying to make sure that you are doing the best you can to keep your baby safe and healthy is a great way to start.
Definitely. Yes, we did a chat, I think, for the newborn week last year at this time with Dr. Ryan, and that was keeping baby safe around the holidays. So as that's coming around, with Halloween, Thanksgiving, Christmas, I'll find that video and link it below. So if anyone wants to watch that recap from last year, it kind of gives some good tips on, I know it's hard to, when family and friends come around, and it's kind of hard to kind of lay those ground rules, but definitely is important to do. So awesome. How often should I bathe my baby, and what is the best way to do it?
Yes. So once baby is born, usually around the 24-hour mark in the hospital, the nurses will give your baby a bath. So I always use that, or tell families that is a great resource to kind of learn how to bathe your baby. And then after that, going home, in those newborn stages, every couple days is fine. You don't have to bathe your baby every day. What I always tell parents is if your baby had a blowout diaper, that's probably the day to take a bath or give your baby a bath. And then resetting the clock from there every 2 to 3 days after that, moving forward. Best way to bathe your baby. So again, they kind of show you in the hospital and you can sort of mimic that, but sponge baths in those first few days to weeks, couple weeks until the baby's umbilical cord falls off is what we recommend, just so things don't get super moist, delay the separation of the umbilical cord. And then after that, it's putting the baby in the tub, trying to keep the baby warm because they sometimes can get a little bit cold. So using like towels, even if they're getting wet, things are going to get a little wet, going to get a little messy, but trying to keep the baby sort of covered with towels or washcloths and that sort of thing. And then I usually say like starting from the head down. So we don't want to contaminate eyes with dirty parts from below and that sort of thing. So starting with washing the face and then moving downward, and kind of going from there. You don't have to be really vigorous with scrubbing at all, just, rinsing using a light, mild soap. And again, making sure like baby stays warm. Some babies love their baths, so you can, lollygag a little bit or take your time with it. My son, when he was first born, he had some bad colic, so he loved bath time. So he got baths a lot because that was one way that we could calm him down, and that's totally fine. Some babies don't like baths and they don't want to be cold, they don't want to be naked. So you can kind of power through as best you can.
Definitely. So this isn't on my question list, but I thought about it while we were talking. I know some people will bathe baby in the kitchen sink. Some people will do it in the bathtub. Is it okay to do it in the kitchen sink, or would you prefer that they go into the bathtub, or does it matter?
I don't have any preference. I really say what works best for you and your family is what is best for your baby. So I think like when my first was born, he was in the little tub, but we put it in the bathtub. Some people use those little baby tubs and put them in their sinks, or some people will put babies directly in their sinks. They have like little padding things you can buy to put in the sink. All of that is fine as long as you're kind of getting baby cleaned up and getting, every again 2 to 3 days. We don't need to wash them too much because their skin is so sensitive, but just getting the dirt cleaned off.
Yeah, awesome. And speaking of their sensitive skin, what skincare products are safe for it, and are there any that you recommend?
Yeah, so there are now an abundance of skincare products for babies, and so it can be a little bit overwhelming. And like I said, baby's skin is pretty sensitive, so we want to be cautious and mindful about what we're putting on their skin. So I usually recommend anything that is like mild or unscented. Brands that I prefer that I will tell families, especially if we're noticing babies that are a little bit rashy or a little bit more sensitive, would be like CeraVe, Cetaphil, Aquaphor brands, that sort of thing. And again, just like the scented things, you may notice that your baby's skin is flaring up a little bit more, getting a little rashy. So trying to stay away from those products may be helpful.
Yes. How do I care for my baby's umbilical cord stump until it falls off?
Yeah, so a little bit like I talked about, usually we just say sponge baths until that umbilical cord stump falls off. That usually happens between the 10 and 14-day mark. So it basically dries up, shrivels up like a scab and falls off like a scab would. We don't want to pick at it. I feel like there were kind of a lot of old school treatment options that people would do using alcohol wipes or putting certain things on it. You don't have to do anything fancy, just kind of leaving it alone and letting things dry up. What we do tell families, warning signs to watch out that maybe it's not coming off properly, or maybe there's concern for something else, would be if it's oozing or stinky or red or swollen or seeming tender, or bleeding, then we definitely want to know about that. Sometimes when the cord does come off too, then it can be still a little bit oozy. I tell families, give it a couple days. If it still looks moist after that, then sometimes we want to treat it with a little medicine in clinic. But usually just leaving it alone is kind of best step. They make those notches in the diapers to kind of go under that umbilical cord so that we're not rubbing against it, or even just folding the diaper down can kind of help prevent any irritation there as well.
Awesome. Okay, so facial region question. How can we clean our baby's ears, eyes, and nose safely? So maybe starting with ears.
Yes, and I get that question all the time in clinic. Like, how do we clean out their ears? Because a lot of times you'll read on the internet or we'll tell families like not to use cotton swabs or Q-tips in the ears just because sometimes it can push things in or cause damage. So typically what I tell families, like using your washcloth, kind of wrap it around your finger, put it in the ear and gently, your finger's not going to be able to go in their ear. So kind of gently swirling around each side with your washcloth, washing behind the ears and around the ears, and then just rinsing things off. Same sort of thing with the eyes, a gentle washcloth and rubbing over the eye. I usually do like eyes first, and then you can do ears or around the mouth and that sort of thing. But again, a gentle washcloth, rinsing with water, mild soap, all fine to use.
Awesome. And then nails. So, how do we trim our baby's nails, and especially when they scratch their little faces?
This is another question I get all the time in clinic or even like in the hospital. They'll be like, or parents will be like, oh, I have the baby clippers. Can you show me really quick how to clip baby's nails or something like that? To be honest, I didn't clip my son's nails for like the first year of his life. I don't know why. It just was something that my husband did, and I kind of left it up to him. And I was sort of intimidated by the whole process
Yeah.
too. But once my daughter came around, then
Okay.
I can now clip a baby's nail, I will say.
Yeah.
However, their nails, what I tell families too, their nails are sharp as heck, but they are flimsy. So you
Okay.
can try to like buff them down or use a nail file, but it might not work that great because they're so flexible and flimsy. So
Mhm.
like the little nail clippers or even they make like little nail scissors you can use to just kind of cut straight across the nail. We don't want to, you don't really just pushing the pad of the skin back so we don't have any trauma or damage there and just cutting straight across. You don't have to cut them too short.
Mhm.
Again, even when they are short, they are just still sharp. So sometimes it's inevitable that babies are going to scratch their faces, and that's okay. They heal very quickly.
Yes, definitely. Let's talk about some skin issues. So, how do we recognize and treat some common ones like diaper rash or cradle cap?
Great. Yes. So, cradle cap is something that we'll see very common in newborns, young infants. So that's like the flaky yellow scales on top of the scalp, kind of in the hairline, and it's called cradle cap. The fancy word for it is seborrhea. So but number one, you don't have to treat it. Eventually, it will go away on its own.
Mhm.
But number two, if it's bothersome to you or you feel like your baby's bothered by it, you can treat it. What you can do is we usually say like softening up the scales with a light oil. You can use olive oil, you can use coconut oil, you can use baby oil to soften up those scales on the scalp, and then do that like 10 minutes before bath time, and then during bath use that little scrub brush to kind of buff those scales off. Um, a lot of times, like I said, it's sort of inevitable that if your baby has cradle cap, then those scales will eventually come back until it's, done with its whole course. Um, so you can do that with the bath times or, every other bath or whatever to try to get those scales off. And then don't be alarmed if they come back, and that's okay too. There are some other like certain shampoos and a little bit older babies, I'd say like past the 2 or 3 month mark, that you can use like anti-dandruff shampoo, just a tiny amount, and use that like every other bath or once a week or something like that to try to work on some of those scales as well. Um, but yeah, again, not anything that we usually worry about, but always if you have questions about that, let your pediatrician know.
Mhm.
And then diaper rash was the other thing. So babies will get diaper rashes all the time. That diaper kind of holds moisture in that area, in the diaper area can get a little bit raw. So just having creams on hand. Again, every baby's skin is a little bit different. They'll react differently to certain diaper creams. Zinc oxide is kind of the number one diaper rash cream or protectant, skin protectant that will slather on. There's lots of brands that have the zinc oxide in there. So just having some of that handy. Other people will use like a petroleum jelly or Vaseline type Aquaphor, but whatever works for your baby. And then there sometimes can be those more like stingy diaper rashes that we want to make sure if we can't get them to go away as a parent, bringing into your pediatrician and just see if there's other recommendations, because sometimes there's like a yeasty diaper rash or something else that might need treatment.
Mhm. Yeah.
I would
I
say sorry, I'll talk about one more skin thing because this comes up all the time too. I know I've mentioned like sensitive skin. Along with that goes eczema, or like a contact dermatitis. So we see that a lot in babies too. And I tell families like sometimes the dry air in the winter months can flare up the baby skin. Sometimes the humid air and the heat can flare up a baby skin. And so again, talking to your pediatrician about ways to kind of help with the dry eczema or like those red patchy itchy areas on the skin. Again, moisturization, super important to kind of keep things at bay. Sometimes we have to do topical steroids. So if you notice that in babies, common spots for eczema patches would be like on the face, even on the trunk, sometimes like elbows and that sort of thing. So always reach out to your pediatrician if you have concerns about that. That can run in families too.
Yeah, definitely. Okay, I see some great questions coming through on the comments, so just know we're saving time at the end for a Q&A. Thanks for commenting.
Awesome.
All right, let's talk about vaccination. So what does that kind of look like for a newborn in the first 6 months?
Yes. So most pediatricians you'll meet are probably very strong advocates for vaccine. I am as well. So even when I meet families in clinic before they've had their first baby, we talk about vaccines because that's a very important part of keeping your baby safe and healthy, and being proactive to keep your baby safe and healthy. So the very first vaccine that your baby gets is a hepatitis B vaccine at birth. Usually, right after birth, they get hepatitis B vaccine. And then the next big vaccines are at the 2-month, 4-month, and 6-month well checks that we see babies in clinic for. The way that vaccines work is they put a little part of a bacteria or a virus into baby's body, and then your baby makes antibodies against that virus or bacteria to protect them if they were to come into contact with those things. So the big ones that we do in the first 6 months are, like I said, the hepatitis B, Hib, which is like a brain and spinal cord infection. Prevnar helps protect against pneumonia diseases. Hepatitis B, Hib, Prevnar. Rotavirus helps protect against diarrheal illness that kids can come into contact with, especially through daycares. That one is an oral vaccine. The rest of these ones are injections, and they do come in combination forms so that your baby doesn't have to get like 6 shots. At our clinic, we say 2 pokes and a drink. So 2 injections and 1 oral vaccine. Polio, and then diphtheria, tetanus, pertussis are standard vaccines. And then very exciting, we have the RSV vaccine. I'd say vaccine. So like I mentioned, most vaccines work by giving a part of the virus or bacteria to stimulate your body to make antibodies. The RSV medicine gives the antibodies directly to babies. So baby doesn't have to mount that immune response. Babies are just ready to go as soon as they get that medicine to fight RSV infections. That one is recommended for all babies less than 8 months old to prevent them from that severe respiratory illness, RSV, that is can be very dangerous in young babies, #1 cause of hospitalization in young babies. So we have that available in our clinic too. Like I said, all babies less than 8 months, we're trying to get them all get that medication after October 1st. So we've been actively doing that in clinic, or as soon as after baby's born, if they're born after October 1st, we're giving that. Caveat to that, mom is able to get the vaccine during pregnancy. So if she has been adequately vaccinated, then baby might not need it because the baby will get mom's antibodies.
Mm-hmm. Yes, that's great. So that was a lot that she listed. I know we have
Yes.
it on our website, boystownpediatrics.org. I'll find it after this video and link it in the comments, but we have it all written out of, I think it's even up to 5 years. We have it
Yeah.
segmented. So if you're kind of looking for more info on what are the vaccines and when do they happen, we have all of that on our website too.
And another thing I'll say about vaccines is talk to your provider. Some people are hesitant. There's so much information out there. Is this the right thing to do for my baby? Should I wait? Should I do it now? We give vaccines based off of like CDC, federal regulations and guidelines, things that have been studied for many, many years. So we kind of hope you trust our information and our judgment, and we give you the same respect and want to talk about all the vaccines with you if you have questions. And then at the 6-month mark, I know we're kind of talking about 6 months and under, but 6-month mark, babies are eligible for COVID and flu vaccines if that's something you're interested in as well.
Mm-hmm. Yes, definitely. As I mentioned on Monday, the overlying arch of this is just ask your pediatrician
Yes.
and
Yes.
have them on these lives, but only for, 30, 45 minutes of the whole time. So I always link our meet and greet form, and we have a 24-hour nurses line. We have same day pediatrics. There's always someone at Boys Town to help answer your questions day or night.
We love to have those conversations with you.
Yes. So going into, you talked a little bit about RSV, but what are the signs of common illnesses in newborns and when do we seek medical attention?
Yeah, so that's a great question. Again, some of the advice we'll give, like things to watch out for in those early stages, the day before you leave the hospital, we kind of talk about these are things you need to watch out for going home. We hope they never happen, but you're prepared a little bit if they do. So those really young newborns, illness can sometimes be a little bit hard to define or notice. And so if your baby's not feeding well, if your baby's so sleepy, if your baby's constantly fussy, those may be signs of illness, even without like a fever or a runny nose that you might notice in an older kid. Um, if baby's not peeing well, like not having good wet diapers, then the baby might be a little bit dehydrated. That might make them sleepy. All of that, again, can be signs of illness. So those are the big things in that like early newborn stage that I'll tell families that we want to watch out for. And then fever is obviously like another big indicator for illness. So a fever in our world is anything above 100.4 or higher. So we want to know if, especially any baby less than 1 month old, we want to know about those fevers. That's considered an emergency in these really young babies. And then as babies get a little bit older, again, like respiratory distress, signs of abnormal breathing, that would be something that may indicate a respiratory illness. The poor feeding, fussiness, vomiting, diarrhea, fever, severe rash, those are all kind of illness signs, things to watch out for. And always, again, if you're worried, give us a call. If you feel like you're in an emergency situation, just take your baby to the emergency room. It's better I think, to get that reassurance than sit at home wondering and be anxious and something not great happen. Let's see, what else was I going to say about that? I can't remember. But yeah, I think fever is one of those big things, especially, like I said, less than 1 month old. As babies get older, especially after their first set of vaccines around 2 months of age, we don't get as concerned for fevers because we know they happen with these viral illnesses and colds that every kid is going to eventually get, at some point. So we don't get as worried unless we're like having prolonged fever. And I think the other thing that comes up a lot in pediatrics is the height of the fever. So a fever of 104 versus a fever of 101 to me doesn't tell me that the fever of 104 has a more severe disease than the fever of 101. Baby could have a cold and have a fever of 104 and be okay. But a baby with a fever of 101 may have like a bad UTI, urinary tract infection, needing antibiotics or something like that. And that would be a more serious illness. So just be mindful of that. But if you have questions, again, we're here for you. We have our 24/7 nurse access line. We want to hear from you about those fevers. So again, nothing to brush off. Let us know, especially in those first 6 months, and we can help you out.
Mhm. And this made me think of a question about a fever. What is the best way for parents at home to take baby's temperature?
Yes, that is another question that comes up. Thank you for saying that. So a lot of parents will do like the forehead thermometer or an ear thermometer, even like the scanner thermometer. I think those are okay to start with. But if it's elevated, again, if it's like 100.4, then really the best way to double check and confirm we want that true fever measurement is a rectal temperature. So getting those little thermometers, having one on hand. Again, you don't have to use it every time, but if baby's feeling warm, something's off, checking a temp. If it's high, you can confirm with the rectal temperature and let us know. So that's the one. Goes in the bottom. I usually say tiny bit just so you can't see the tip of the thermometer anymore. And that'll give you a good like core temperature reading that's important to us.
Perfect. Thank you. Okay, I only have a four more questions here on our list, and then we'll hop into the Q&A. So if you have a question for Dr. Empson about health and hygiene, go ahead and leave in the comments, and then, of course, we'll draw for the giveaway after that. So we talked about vaccinations, but are there other ways to boost our baby's immune system?
Yeah. So, I mean, vaccinations are probably number one, because those are going to boost the baby's immune system against those things that we worry about. And then I think, keeping baby healthy, having baby gain weight appropriately, teaching baby how to wash their hands, even from an early stage. Once they start eating solids closer to 6 months, like washing their hands, getting them used to that, wiping hands after diaper changes, because everything eventually goes in the mouth at some point. So being mindful of that will keep baby healthy. And then again, keeping people around baby up to date with their vaccines as well can keep your baby healthy. There aren't like any supplements or anything like that that I recommend to boost baby's immune system. So yeah, I really think it's immunizations, washing hands, like your normal hygiene stuff that you would do as an adult, is best to keep baby safe and healthy. And then in those really young, early stages, avoiding like large crowds and being around sick people and that sort of thing.
Mhm. Yeah. All right. So, along with kind of fighting germs, how can we clean and sterilize bottles, pacifiers, and other baby items?
Yes. So, bottles, pass, all those things that go into baby's mouth. We usually say like first time in for newborn should be sterilized regularly. Like first time use, you want to sterilize everything. That can be so boiling water and then taking off the stove and putting your objects in there for like 5 minutes and then taking them out. If you put them in the actual like boiling water, your stove's still on, you might have some warping. So just being mindful of that. But that will sterilize things. And then there's lots of companies out there now that are making sterilizing machines, sterilizing bags that you put a little water and put it in the microwave and that steams things up. So that works nicely too. Any of those options I think are fine. And then doing, after the newborn period, after the first month, if baby's healthy, not premature, then you can kind of do your normal washing and every once in a while, usually say like end of the week or something like that, sterilizing your products. Some people might do it a little more regularly than that, not harmful. But not necessary to do like every single use to sterilize those things. If baby is actively ill, then just being mindful of like, oh, they've used this pacifier, they were sick, it's the end of the week or the end of the day, maybe we should sterilize that and use a new one so we're not like recontaminating either.
Mhm. Yeah, definitely. Okay, so oral care. What do we need to know about prepping for that before baby's teeth come in? And also, if you kind of want to talk about what happens when they do come in, what's that like? That would be helpful.
Yep. So a lot of parents come into clinic say, my baby's teething around like the 4 month mark. Maybe I have seen some babies with teeth come that early, but typically teeth come in around the 6 month mark or a little bit after. But we can keep the mouth nice and clean or help baby with that early on. So you can wipe the gums with like a moist washcloth, morning time, nighttime, and kind of getting used to that oral care. And then once teeth do come in, then I just recommend brushing. So they have the silicone finger brushes or like just regular soft bristled toothbrush. You can use that morning time, nighttime. Even if it's 2 teeth, it's never too early to start brushing. And that gets baby kind of used to things too as we get into those like toddler ages where they are a little more defiant or want to say no and not brush their teeth. Maybe they'll remember, oh, we've been doing this every day for a long time now. And then the pediatric dentists, they recommend, as soon as baby pops their first tooth, they are happy to see them in their clinic. Some family dentists may wait a little bit longer, around 2, but I usually like to get or encourage families to see a dentist by 2 years of age or so. That way we can just get those, regular dental checkups, cleanups, and that sort of thing in the books. And they talk a little bit more in depth about oral hygiene in their office as well. And then as far as what to use on the toothbrush, so in those early stages, you can do water, but once that first tooth comes in, we do want to protect the baby with fluoride. So using very small amount of fluoridated toothpaste is okay. And by small amount, I mean smear, size of a grain of rice or smaller, just eensy beensy. Because the baby will swallow it. They're not going to know how to spit it out. My almost 4-year-old still doesn't spit out his toothpaste. So just being mindful of that. We don't want them to swallow too much of the fluoride, but Good to protect their teeth. Okay that they swallow some of it. I just don't want them to eat a whole tube of toothpaste. So
Yeah. So we know with teething, babies aren't always happy when they're teething. Is there anything that we can do to reduce pain or, teething toys? What would you recommend for that?
yeah, so lots of options out there, like cool washcloth, things you can put in the freezer, totally fine. Babies' teeth are exceptionally sharp. Like I talked about their nails, super sharp. Teeth are also super sharp. So just being mindful that you're kind of assessing or evaluating the strength of those teethers. Cool things are nice, but anything that may have like gel or a liquid in it that's a teether, just be mindful that there is the possibility of a puncture and we wouldn't want baby to ingest those contents. So being mindful of that. But even just like a cold, wet washcloth throwing in the freezer, that can feel really good for baby. And then if super fussy at nighttime, it's okay to give Tylenol. We don't recommend ibuprofen for babies less than 6 months old. So no ibuprofen, but Tylenol is okay. And if you're wondering about the dose, just reach out to your pediatrician.
Mhm. Awesome. All right. Awesome. We're going to go right into the Q&A. So thanks for answering all those questions, Dr. Empson. Okay. This user says, my baby will be around 2 weeks old for Christmas. What are your thoughts on having others around baby during this busy time or bringing them to holiday gatherings?
So I think it is each parent's, own decision, how you feel. I had a baby a couple weeks before Christmas as well, although that was COVID 2020. So I don't
Yeah.
think we did anything for Christmas that year. But I think it's just risk versus benefit. So if people are going to be well, then it's fine to attend if you're comfortable with that. If baby has any medical conditions, prematurity, that puts them at a little bit more risk for those more serious infections. But again, if baby's vaccinated, if you can get the RSV vaccine, that will, I think, make you feel a little bit better and put you at peace of mind. But if somebody's sick, or you can go and say, I'm just going to hold my baby, but we will be here type thing, that's okay too. Because, the closer contact, those respiratory droplets, snot, that sort of thing that people can spread, the closer the contact, the higher risk they are for spreading anything potentially.
Mhm. Yeah. Is there a good hypoallergenic soap that you recommend?
I don't know if it's like hypoallergenic per se, but again, those like the CeraVe, the Cetaphil ones are great. There's a brand called Mustela too that I really liked for like cradle cap and dry skin. It just seemed to work very well for my kids. I really think, it's whatever out that is out there. So many things out there. So it's like whatever one works best for your kid is the one that's okay to use. And you might have to do a little trial and error. So reach out to friends, see if they have some you can borrow so you don't have to buy a whole bottle if it doesn't work out.
To say they ask the same for laundry detergent.
Do have thoughts on laundry detergent only because there is a brand out there that is targeted to families for newborns. That's Dreft. It is a scented detergent, and so it actually can be a little bit irritating to baby skin, even though it's marketed as like this is great for your newborn. So just being mindful of that. Free and clear detergents for sensitive skin are the way to go. There's lots of brands out there that don't have any dyes or scents, so that's what you'd want to stick with if you do have those kiddos with sensitive skin.
Perfect. Okay, we had a question on how often to bathe. So you said every 2 to 3 days for that, right?
Mhm.
Okay.
Yeah, and you can go a little bit longer too if your baby skin dries out really easily. They don't have to be bathed that much. They don't get that dirty. But again, like if there's a blowout, maybe that's bath day type thing.
Yeah. Yeah. Do you have diaper cream recommendations?
I do. I have recommendations for everything. If you
Well,
want to hear name brands, I'm okay. Yeah.
yes, yeah.
Yeah.
Well, you're a mom and a pediatrician, so we know you really know the good ones.
Yeah. So, okay. So I talked about like zinc oxide. That is in most of the standard diaper creams like Desitin. Um, Desitin has like a Target generic, I think the Up and Up or something, that's the purple one that has the more zinc oxide. That's what I've always used on my kids, or Vaseline. And if things are getting really bad, I kind of concoct my own recipe with a lot of different diaper creams and stuff. But yeah, like just the purple Desitin. But then some people are like, I love the butt paste, or I love the Aquaphor, something like that. Again, whatever works best for you is fine. But if you're looking for something good, the cheap Target name brand one is great.
Yeah, great.
Purple one.
Purple one, noted. Okay, we have, let's see, 2 more questions because the last one we already talked about teething. So 2 more, and then we'll do the wheel. How do you care for a baby boy who is uncircumcised? Any
Yeah.
special advice for that?
We'll talk about both because we come across that all the time. So, uncircumcised babies, just again, like your normal washing, they are going to have foreskin. It is still kind of adhered to the tip of the penis. So, we just want to make sure that we're not pulling anything back and just doing like running water over it. We don't need to get soap inside or anything like that. Eventually, that won't be adhered anymore, and you'll be able to sort of pull things back and do washing, but that won't be for a couple years at least. So just normal washing over the area. If things are ever getting red, swollen, painful, then we'd want to know about that for sure. As far as a circumcised baby boy, depends. So after the circumcision, sometimes the doctor will put a little piece of gauze around the area where the incision was made, and we just wait for that gauze to fall off, and you do like your normal wiping to the area, gentle patting because things are a little bit raw. And then once the gauze falls off, kind of same thing. I usually say it heals around the time that the umbilical cord comes off. So no sponge baths, submersion in water until that's all healed up around the 7 to 10 day mark. And then during that time, you just use petroleum jelly or Vaseline to the area so that it doesn't stick to the diaper. Your doctor, your pediatrician, whoever did the circumcision should, or even the nurses in the hospital, kind of talk to you about that before going home. But yeah, easy to clean. Again, can be intimidating. I'll even talk about baby girls. Why not, since we're here? So lots of folds to the area, just kind of spreading things apart, using a wipe, cleaning everything very nicely with diaper changes, wiping front to back, super important for baby girls. So we're not introducing bacteria from the stool into parts where we don't want it to be. But yeah, there's lots of folds. So just, cleaning in between all of the folds, super important for baby girls. So yeah, we got boys and girls, and there we go.
Very helpful. This is why the Q&A brings the best questions.
Yes, it does.
Whenever I write these questions, I'm like, I think I covered most of the aspects. And then I'm like, oh, well, now it's a huge part of health and hygiene. So thank you for bringing that up. Okay, we'll do one more question here and then we'll spin the wheel. Some fun. This user is asking, she has gestational diabetes. What, if you know, is the best way to help baby regulate their blood sugar after birth?
So being able to have breast milk available right after is probably most helpful. They'll be checking baby's blood sugars most likely. So to prevent that hypoglycemia or low blood sugar, having something to feed baby available from the get-go. If you don't have colostrum or aren't making, usually early on, there's not much coming out, but there's donor milk available in the hospitals, formula and that sort of thing to supplement if needed. If sugar is really, really low, then they do like an oral glucose gel to try to get that sugar up. So good question.
Yeah, perfect. Okay, so before I spin the wheel, I just want to remind everyone that we have Dr. Empson and we have a free meet and greet form. So I'll link that if you listen to this chat and really liked her or liked any of the peds that we talked to this week and would like to use them for your child's pediatrician. And also, Dr. Empson, you do rounds at the hospital, right?
I do. I round at Methodist Women's Hospital. Happy to see any babies there. We help out the team round there, and then I see all my own families that are having newborns there as well. I live close by, so it's easy for me to get over there.
Yeah, awesome. All right, so we're gonna go ahead and spin. This is the baby bathing basket. Kind of a tongue twister, but the winner is Hannah D. Congrats, Hannah. We'll send you a message from your page to claim your prize. Awesome. Well, thank you, Dr. Empson. We talked about so many good things in this live, and we really appreciate you joining.
Awesome. Thanks so much. Good
Yeah.
luck, everybody out there. Let us know if you need anything.
Yes, we will be live again tomorrow with Dr. Schneider talking all about decoding crying. So, why does baby cry? What does it mean? Stay tuned and we'll talk about it. So, we'll see you tomorrow at noon. Thanks, everybody.
Bye.